What are the criteria of Ayurveda diagnosis? How to make the diagnosis based on the Ayurveda fundamentals? This is the topic of discussion in this particular video. Dear ANI community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fitting with the right information at the right time for the right purpose. While knowing about this particular concept, we need to know certain concepts. First of all, Rogaha Sarvepi Mandekno. It is being mentioned in the context of Udara. Almost all the diseases they are considered to be because of Mandagni, or what we can say the poor functioning of Agni, poor functioning of the gunas of Pitta, that is Ushna, Tishna, etc. If they are poorly functioning, then that will be leading to the Mandagni, which is considered to be the disease manifestation, the cause. And most of the Nidana they are considered to be Ahara related. 95% of the cases they are considered to be Ahara related. Either it may be either Adhyashana or Vishamashana or Samashana or Viruddhashana or Atyashana or Ruksha Ahara or Guru Ahara, etc. That means most of the Nidana, 95% of the cases, they are considered to be mainly affecting the Agni. That means most of the Nidana which are entering via mouth, they are considered to be responsible for the Nija Vikara manifestation. And all the Nidana which are considered to be entering through other natural orifices other than mouth, that is either eyes, nose, ears, or the nose, urethra, vagina, anus, breast, etc. They are responsible for the manifestation of Agantuja Vikara. And further, all the Nidana which are entering via mouth, they are leading to the Abhyantara Roga Marga affliction first. Whereas the Nidana which are considered to be entering via natural orifices other than mouth, they are responsible for the affliction of either Bahya or Madhyama Roga Marga affliction. Disease manifestation starts initially from alimentary canal, which in turn leads to the movement of the pathogens from the alimentary canal to intravascular compartment, from there to interstitial compartment, from there to intercellular compartment. In this way, the disease manifestation starts. Whereas the line of treatment is considered to be reversal of this particular movement of the pathogens. So that means from the intracellular compartment to interstitial compartment, from the interstitial compartment to intravascular compartment, from the intravascular compartment to alimentary canal, from the alimentary canal to the exterior, either through the oral cavity in the form of vamana or through the rectal route in the form of either virechana or basti, or via nasal route in the form of nasya, etc. We are going to do the line of treatment. In this way, this is what is considered to be the fundamentals that has to be remembered while knowing about the Ayurveda diagnostic criteria. As far as mechanism of Vyadhi is concerned, it is being mentioned in the Ayurveda. So these are considered to be Bahya Srotas: mouth, eyes, ears, nose, breast, urethra, anus, vagina. They are considered to be the Bahya Srotas. Among them, so the mouth, it is considered to be most of the occasions, more than 95% of the cases, the person will be having the entry of the pathogens taking place through this particular route. Whereas the other areas where the percentage of entry of pathogens will be comparatively less than that of the mouth. So, as we have discussed earlier, so source of the entry of the pathogens that will be taking place either through Adhyashana or Vishamashana, Samashana, Viruddhashana, Atyashana, Rukshashana, Snigdhashana, etc. etc. Whereas the other ways, for example, the Rajaha Sevana, maybe to the eyes or nose, so that will be leading to the Agantuja Vikara manifestation. Whereas the breast milk as such, in case of the ladies who have given birth to the infants, so they are most frequent sufferers of what you say that the breast infection, etc. The frequent sexual intercourse may be associated with the urethral infection or vaginal infection, etc. In this way, the human body natural orifices and the pathogen reactions that can be determined from the area of the entry of the pathogens into the body. As it is being mentioned, the pathogens, if they are entering via mouth, they are responsible for the disturbances to happen in the alimentary canal, which is considered to be the Abhyantara Roga Marga. Whereas the pathogens which are entering into the skin, etc., they are responsible for the what you say that Bahya Roga Marga affliction. If there is any kind of the entry of the pathogens are taking place here or here, etc., so that will be responsible for the Madhyama Roga Marga affliction. In other words, the pathogens which are entering from the Abhyantara Roga Marga, they may enter either to the Bahya Roga Marga or Madhyama Roga Marga via intravascular compartment, interstitial compartment, and intracellular compartment. Hence, the line of treatment will be the reversal of the pathogens movement from this, that is intracellular compartment to interstitial compartment to intravascular compartment, and intravascular compartment to alimentary canal. From there, we are going to eliminate it. Why we need to know about the mechanism of Vyadhi? So that is the main reason, that is removal of the pathogens, that is from the nearest root, that is considered to be the line of treatment in most of the occasions. And Ayurveda says the removal of the pathogens are usually from the natural orifices, maybe the mouth, anus, or the nose, eyes, ears, etc. So that is in the mouth, maybe the what do you say that the Vamana, if the person is suffering from kapha dominant diseases, Vamana will be given. If the person is suffering from Pitta dominant diseases, Virechana will be given. If the person is suffering from Vata dominant diseases, then Basti is being planned. Whereas if the person is suffering from diseases related to eyes, Akshitarpana, etc., that will be Putapaka, etc., that will be planned. If the person is suffering from the Karna Roga, Karna Purana, etc., that will be planned. If the person is suffering from any kind of the Nasa Roga, Nasya will be planned. Mukha Roga, Gandusha. If there is any kind of the affliction of Upastha, then Uttarabasti or Unipitu, etc., that will be planned. This is considered to be the removal of the pathogens that will be taking place from the nearest root. For this particular reason, we need to know about the mechanism of Vyadhi. Regarding the mechanism of the Vyadhi and Chikitsa is concerned, so this particular image shows about the mechanism of Vyadhi, whereas this particular image shows the mechanism of Chikitsa. So here it is being mentioned that most of the occasions the pathogens which are being accumulated in the stomach or small intestine, large intestine, from there it may enter into the intravascular compartment. From the stomach it may enter into intravascular compartment, then into interstitial compartment. From the stomach, some of the pathogens may enter into the intravascular compartment, then to interstitial compartment, then to intracellular compartment. In the same way, The pathogens in the small intestine that may enter either into intravascular compartment or interstitial compartment or into the intracellular compartment. The same way, pathogens may enter from the large intestine to intravascular compartment, then to interstitial compartment, then to intracellular compartment. This is possible if the pathogens are entering via mouth. If the pathogens are entering from the eyes, ears, nose, urethra, vagina, anus, or breast, then in that particular situation, they may enter from these natural orifices directly into the intracellular compartment. Hence, we have to have the elaborate history of clinical presentation, chronological order of the development of the symptoms that are required. Whereas chikitsa, so that means the reversal of the movement of the pathogens from the body to the alimentary canal. So this particular image that is showing the exact reversal of the movement of the pathogens. Suppose if the pathogens are present in the intracellular compartment, we need to make it into the interstitial compartment. Then we have to make it to move into the intravascular compartment, then to stomach. Suppose if the pathogens are not present in intracellular compartment, if they are present in the interstitial compartment, then we have to bring it into the intravascular compartment, then to stomach. Suppose if the pathogens are not present in the interstitial as well as intracellular compartment, in that particular situation, if the pathogens are present in the intravascular compartment, then we have to make it into the stomach, then we have to eliminate it in the form of vamana. In the same way, if the person is having the pathogens specifically related to pitta dominant condition, then we have to make it into the movement of those pathogens into the small intestine. Whereas if the person is having vata dominant pathogens, then we have to make it into the large intestine. Then we have to eliminate it either via virechana or basti respectively. Whereas some of the pathogens, they are entering from the body and they are localized in one particular part of the intracellular compartment, then ideally we can perform rakta mokshana. This is how we are going to plan the chikitsa. Now, how to understand the vyadhi there? Vividam dukkham adadati iti vyadhi. Various kinds of the discomforts which are generated in the body because of the entry of the pathogens into the body via either mouth or other different natural orifices, that is considered to be vyadhi. Now, how to make the diagnosis of the vyadhi as per Ayurveda understanding? For this, we have to know about these are the different parameters to know about it. Regarding the first and foremost, Nidana, responsible for the manifestation of the dosha vitiation or dhatu affliction. So, vitiation of the dosha, either single dosha vitiated or dual dosha or triple dosha vitiated. Dhatu or mara affliction. Srotas affliction. Srota dushti involved in the disease process. Agni or ama involvement in the disease manifestation. Roga marga involvement. Whereas sadhya sadhyata assessment. So these are the different the points that has to be considered while making the Ayurveda diagnosis. Regarding the nidana leading to the disease as such, what are the different points that has to be considered? That is duration of the exposure. Whether is it in hours or days or months or years. If the person is having the duration of exposure in terms of the hours, the dosha vitiation, etc., that will be milder. If the person is having the exposure of the nidana in terms of the months, then in that particular situation, the dosha vitiation will be comparatively moderate. If the person is having the exposure of the nidana, that is being considered to be for years together, he may have the dosha vitiation to a severe extent. So, by knowing about this particular nidana, we have to know about the increase of either one guna or two guna or multiple guna in the body. Maybe it is ruksha guna or lagu guna, or maybe ruksha or lagu guna, or maybe Ruksha Laghu or Shita Guna, or maybe Ruksha Laghu Shita or Jala Guna. In that way, you need to know about the increase of the either one or multiple guna in the body that has to be analyzed. Then we need to know about the source of entry of the pathogens into the body. Whether is it from the one natural orifice or multiple natural orifices, whether is it other than natural orifices, whether that particular entry of pathogens are taking place through the skin, that has to be known. Regarding the number of pathogens, whether the number of pathogens are little in number or large in number, that has to be known. Little number of pathogens, milder form of the disease. Large number of pathogens, severe form of the disease, that has to be noted. Virulence of the pathogens entering into the body. Less virulent pathogen, less severe form of the disease. More virulent pathogen, even though there is little nidana sevana, that will be leading to severe disease manifestation. So here one example is being put forth. Suppose if the person is going to consume this nidana, what are the points that will be considered? Naturally, say that will be leading to pitta dosha vitiation. Naturally, there may be a possibility of increase of either ushna, tekshna, laghu guna, increase in the body. And we are going to expect the dosha vitiation initially to take place in the alimentary canal. And if the person is going to have the consumption of these particular gobi manchurian for months together, then we are going to expect the rakta dhatu affliction. Still, if the person is going to consume this particular nidana, then we are going to expect there may be a possibility of a yakrut or pliha affliction, because yakrut and pliha, they are considered to be the moola of rakta vahasrotas. In this way, we are going to analyze the nidana as such. Let us take another example. Suppose if the person is doing the vyayama. This also the nature of vyayama, that is impact of physical exercise, that determines the entry of the pathogens into the body. For example, vyayama as a nidana. So here, when you see, the lady is taking breath through the mouth. So in that particular situation, the pathogens may enter via mouth. So that means the lady may have the source of the entry of the pathogens may be taking place via mouth. So in that particular situation, the alimentary canal or respiratory tract, that may be having an exposure to this particular type of the nidana. But in this particular situation, as the lady is not consuming any kind of the food, respiratory system, etc., or pranavasrotas may be at fault first, which may be associated with association of a alimentary canal dysfunction may be possible. And regarding the timing of exercise, at what time the lady is doing the exercise, whether is it before food or after food. After food, in the sense, there may be the possibility of a, what do you say, that alimentary canal dysfunction, that may be possible. Before food, in the sense, the respiratory system, that may be fault. Quality of the food intake, what kind of the food the lady is going to consume, whether is it ushna yukta ahara, tikshna yukta ahara, whether it's madhura yukta ahara, all they are going to decide regarding the food intake and vyayama. Frequency of exercise, how frequent the lady is doing the exercise, half an hour thrice a day, or half an hour 5 times a day, or whether the lady is doing the exercise in one sitting, 1 hour exercise, or which particular part of the exercise, part of the body involved, whether in this particular situation, upper limb that will be having the, what do you say, that the exercise in the sense. So blood supply to this particular upper limb, that will be more. Even though blood supply may be observed in other parts of the body, but the blood supply will be much more increased in the upper limb. Hence, the pathogens in this particular situation, there may be the possibility of entry of these into the upper limb more frequently. An environment where the exercise is being done, for example, smoky environment. In that particular situation, smoke will be directly entering into the nose, thereby the smoke that will be having an impact on the respiratory system. In this way, we have to analyze the nidana analysis and its impact on the body functions and dysfunctions. Regarding the dosha vitiation, there may be the possibility of dosha vitiation of either one dosha vitiation or two dosha vitiation or three dosha vitiation. For example, ruksha guna may lead to vata dosha increase. Ushna guna may lead to pitta dosha increase. And guru guna may lead to kapha dosha increase. Lagu guna exposure may lead to vata and pitta dosha increase. Snigdha guna exposure may lead to kapha and pitta dosha vitiation. And shita guna exposure may lead to vata and kapha dosha vitiation. Suppose if the person is going to consume Laghu and Snigdha guna, then we are going to expect Pitta dosha vitiation more, but to a lesser extent Vata and Kapha dosha vitiation. If the person is going to have this Snigdha and Shita guna exposure, then we are going to expect the Kapha dosha increase more and the Vata and Pitta dosha increase to a lesser extent. In this way, we have to analyze the dosha vitiation in terms of the guna. Regarding the dosha vitiation, for example, the individual is going to consume these two substances 20% gobi Manchurian and 30% ice cream. Gobi Manchurian is having the Katu rasa, Lavana rasa, and Ushna, Tikshna, Laghu guna as such, whereas the ice cream that will be having the Madhura rasa, Shita Virya, Guru guna. In that way, so whenever if you think about it, this may lead to the vitiation of Pitta and Kapha. So further, the time of the intake, which is being taken first, whether ice cream or gobi Manchurian, that will be deciding the dosha vitiation which is occurring first, whether is it Kapha or Pitta. Or any other food is being taken in between. If the person is going to consume dadhi or lassi, then we are going to expect kapha dosha increase. And regarding the percentage of salt and pepper in the gobi Manchurian, if the salt is very mild, then pitta dosha increase may be milder. If the salt is being taken a little bit larger extent, then that may lead to pitta dosha vitiation to a maximum extent. Whether chili sauce is being added or tomato sauce is being added, that may lead to again pitta dosha vitiation. What kind of the oil is being used for the preparation of gobi Manchurian? Whether is it sarsha pataila or the groundnut oil, etc. So that will be deciding the pitta dosha increase in the body. In this way, we are going to look into the nature of the dosha vitiation depending upon the nature of Nidana Seva. Regarding the Dhatu affliction, so here two examples are being given. The individual who is presented with pain in the knee joint. The Adhatu affliction in this particular occasion will be Asti Dhatu. Whereas the second example, the patient of jaundice. So here we are going to expect the Rakta and Purisha affliction. If the person is having the yellowish discoloration, Raktadhatu affliction that can be seen. And if the person is having the Shweta Varcha or whitish colored fecal matter, then we are going to suspect the Purisha affliction there. In this way, we are going to analyze the Dhatu affliction. Regarding the Srotas affliction, the same example, pain in the right knee joint. So here, Astivaha Srotas affliction and later Majjavaha Srotas affliction that can be predicted. In this particular example, second example, Raktavaha Srotas affliction and Purishava Srotas affliction that can be predicted. Whereas Srota Dushti involved in the disease manifestation. In the first example, Sangha and Vimarga Gamana. We are going to suspect that. Whereas in the second example, patient of jaundice, Sangha and Vimarga Gamana, we are going to think about. regarding the Agni and Ama involvement. In this particular example, Asti Dhattvagni Manya can be predicted. The second example, Rakta Dhattvagni Manya can be predicted. In that particular sense, Asti Dhattvagni Manya Janya Ama that can be predicted in the first example, whereas Rakta Dhattvagni Manya Janya Ama can be predicted in the second example. Roga Marga affliction. In this particular example, Madhyama Roga Marga affliction it can be predicted because the joints are being afflicted. Whereas in the second example, Bahya Roga Marga affliction it can be predicted, wherein we are going to see the yellowish discoloration in the trunk region. Regarding Sadhya Sadhyata affliction, so here the pain in the right knee joint, the Sadhya Sadhyata may range from either Krichra Sadhya to Asadhya. Whereas in the second example, the patient of jaundice, the Sadhya Sadhyata may range from Sukha Sadhya to Asadhya. This particular range of Sukha Sadhyata, Sadhya Sadhyata that can be analyzed or assumed via duration of illness, chronology of the symptoms, Rogi Bala assessment and Roga Bala assessment. Hence, we have to take the detailed, elaborate case history to make the diagnosis accurately. To sum up, Ayurveda Vyadhi Vinishchaya for diagnosis is an important process. As far as the disease manifestation is concerned, the pathogens move from center to the periphery. That is the usual mechanism. That is from the Abhyantara to Bahya or Madhyama Roga Marga. Here, the reversal of the movement of the pathogens is considered a line of treatment. That is, the movement of the pathogens from Bahya to Madhyama or Madhyama to, so Bahya to Abhyantara or Madhyama to Abhyantara is the line of treatment that is considered to be the main line of the treatment as such. So, the Ayurveda Vyadhi Vinishchaya that is helpful in determining the Nidana analysis accurately, Dosha analysis, Dushya analysis, Srotas analysis, Agni analysis, Ama analysis, Roga Marga analysis, and Sadhya Sadhyata analysis. Dear ANA community members, that is what is the discussion that is being done in this particular video. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video you like to see in the comment days in this particular channel? Mention in the comment box below. And spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching the right information at the right time for the right purpose. Thank you for watching this video. Once again, something more in the next video. Thank you.